Rich man, poor man, beggar man, thief. Doctor, lawyer, merchant, chief. The thing about drug and alcohol addiction is there are no social barriers. From our most vulnerable to our most revered, anyone is susceptible. Take Dr. Fergus Aitchison, seen here in an interview with TVNZ 2 years ago, a well-respected Gisborne physician and a pethidine addict. 10 years ago, Dr. Aitchison developed a pethidine addiction while working in Taupo. He turned himself in to the Medical Council, undertook drug and alcohol counselling, and for 8 years was subject to random urine tests, all of which he says came back negative. To all intents and purposes, he was clean, a recovered addict. But 2 years ago, while working in Gisborne, after years of drug-free practice, Dr. Aitchison left the Medical Council's supervisory program. By mid-last year, he was using pethidine again.
Opiates are very addictive substances. On the other hand, alcohol is as well. But opiates are usually taken by injection, and that gives an immediate relief to the person, the sort of relief that they're looking for.
Pethidine is a painkiller with effects similar to morphine. Initially, users get an immediate sense of euphoria. But one doctor who's a recovering addict has told Close Up that within months, users fall into severe depression. Pethidine becomes the only way to numb the darkness.
It's conceivable that people could use opiates on a regular basis, and if they controlled them well enough, that it wouldn't be noticeable to others, and it may not necessarily affect their cognitive function. On the other hand, the problem with opiate use is its unpredictability, and people will tend to have highs and lows, and that could affect people's moods during the course of their work.
Of all professions, shouldn't doctors know the pitfalls of drug abuse though? But statistically, medical professionals have a higher rate of addiction than the general public.
From medical school, they are taught that they are incredibly special people. Well, of course, in a way they are, because they have to be very intelligent and highly motivated and goal-oriented to get into and stay and complete medical school. And the combination of being so highly esteemed by the public and the position they have in terms of holding somebody's life in their hands and their own egocentristic sort of moves, it makes them believe that they're bigger and brighter and bolder and smarter and bulletproof.
But there's no silver bullet and no one is immune. What's more, doctors have easier access to drugs in a stressful environment. Fergus Aitchison told us in an email,
the major contributors to that relapse were burnout and workplace stress, which are significant and prevalent problems in the public hospital system.
I think the environment in which we work is getting more stressful for a whole host of reasons. Some of them are financial, some of them relate to the environment in public hospitals and so on. Some relates to the litigious nature of the practice these days and all the disciplinary processes that doctors can be put through.
Dr. Philip Bagshaw is part of a group trying to set up a national support program for doctors under stress.
Whether the drug and alcohol problem is bigger, we're not able to measure that. What we are able to measure, and what we do know, is that there is increasing stress, and that if you look at things that we can measure, like levels of depression and things like that, they are definitely increasing.
New Zealand has around 11,000 doctors. 168 are currently being monitored by the Medical Council for problems like addiction or psychiatric or physical problems which may affect their work. Of those, 39 have a drug and alcohol dependency. That's up from 29 5 years ago. But the problem is the Medical Council relies on doctors or their colleagues to refer themselves.
Statistically, there has to be more who are having problems. We received a referral of a physician who scrubbed up, put on his greens, walked into the OR ready to do a procedure, and they breathalyzed him, and he was like double the legal limit for driving a car.
While alcohol is obviously easily accessible, how about narcotics? In some cases, doctors have been caught over-ordering drugs or writing prescriptions for fictitious patients. So what happened in Gisborne with Dr. Aitchison? Gisborne's private Chelsea Hospital says there's no way that Dr Aitchison would have been able to obtain pethidine while working here because of strict guidelines, which mean only an anaesthetist can actually administer the narcotic. But that wasn't the case here at Gisborne's public hospital. For almost a year, the doctor was able to obtain enough pethidine to sustain his habit. We wanted to ask the hospital how that could happen, but they refused our request for an interview.
I would suggest that all DHBs need to review their policies in this regard as to how well addictive substances are controlled and stored in hospitals.
So should patients know that their doctor is being monitored for drug or alcohol dependency?
You do get personal rights being balanced up against patient rights here. I think if there's any evidence that the doctor is at risk of significant work impairment, the answer is yes. But if the problem is stable and being managed properly through the monitoring programs, the answer may well be no.
But are the current programs enough? Most doctors Close-Up talked to said no.
No, I don't think so at all. I think they need a much more aggressive impaired physicians program, similar to what you would see in some of the states in the United States, to where there would be active peer committees that would be handling interventions, to where there would be a much easier and less potentially punitive track for docs that won't help, to where there would be even some funding from somewhere to help physicians that need good treatment.
This country can't afford to throw doctors on the scrap heap. I mean, people are rehabilitatable. Many are rehabilitatable back to the jobs they had before, and it may be that if they do have ongoing problems, they need to be rehabilitated into a job with less access to that sort of issue.
As for Fergus Aitchison, he says he's once again taking part in a program with the Medical Council. He isn't planning a return to practice.